My mother-in-law did AmeriCorps when she was younger. She told me a lot about the program. She actually encouraged me to join as an AmeriCorps and serve the community. And the more she talked about it, the more it made me want to be a part of it and serve the community in the way that I can.
Before I joined AmeriCorps, I really didn't know what I was going to do, and then AmeriCorps kind of came in front of me and I was able to take that opportunity and kind of change my career path.
I'd gotten this undergrad degree in Spanish. I'd gotten this year of training with AmeriCorps. I was over at the Westside Health Center, and that was my first exposure to primary care.
I think AmeriCorps at Cherry Health is a really unique opportunity because we're able to get all kinds of people in the program, from people who maybe have a GED, or people who just graduated or will be graduating, or people with bachelor's degrees. I've even seen people with master's degree in this program.
My idea of family medicine really came from Westside Health Center. I kind of knew what to expect and felt comfortable coming back after medical school residency. You kind of get where you came from.
The challenges from becoming an AmeriCorps member to becoming an optometric tech has been a lot. It has been very challenging, but one thing that I love to remember is a quote that I heard. Someone mentioned that a good sword is made with a lot of pressure and a lot of heat. And that's how a good sword becomes nice and sharp and very durable. So it's the same thing. When you're going from one position to another, there's gonna be some hard times. You are gonna be pressed, you are gonna have that heat, but that's gonna make you a better employee in the long run.
As far as AmeriCorps, that experience, leading them to potential healthcare professions in the future, I think that in almost all healthcare professions, some amount of observation is always good. And so, especially in a public health setting, I think that in a community health center, that's not on everybody's radar that's going into a health career. And so I think by having that experience here, seeing the work that we do with patients, seeing the integration of our care, it's a great exposure for them. And I think that they see the value in our work and are probably more interested in working here, especially when they do, like Cindy, are bilingual. They know they're gonna serve a community that's gonna really value them.
During my AmeriCorps year, besides medical interpreting, I was also involved with the community, for example, with Habitat for Humanity. We helped build a couple of houses for a family in need. We also helped plant some trees that are actually still on Burton, near Eastern, between Eastern and Madison. So every time I drive by there, I remember that year, I remember the experience, all the people that I worked with, and everybody's smiling faces. So that's still something that's very strong in my mind.
If I didn't do AmeriCorps, I don't know where I would be right now. AmeriCorps really formed who I am as a professional in this world, and it taught me the value of service in the community. And it taught me the value here at Cherry Health of doing mission-driven work, of doing selfless work, and of realizing that you have talent inside you that you can use to benefit other people that you don't even know.
I guess the idealism of AmeriCorps was enough to make it through the long hours of residency, and it was nice to have the experience of AmeriCorps. Reminded me what I wanted to do, that I wanted to help make a difference in the community.
One of the most important things that I got from AmeriCorps have been the experience that I've gone through with a patient while interpreting for a provider. For example, there was one occasion where I had to interpret a very uncomfortable conversation from the provider with the patient. But it also helps show the importance it is to be able to be that bridge in between a provider and the patient.
AmeriCorps has truly been the honor of my life. From being a member, to being program staff, to graduating to Cherry Health staff, and to be here now in my fourth role at Cherry Health, it's just been the honor of my life.